Last month, Canada released a new national autism strategy, which a lot of people had been asking and waiting for. But now that it's here, parents of children with severe autism are calling it inadequate or worse. The multi-year action plan outlines 5 key priority areas, such as improved screening, diagnosis, and services across Canada. And speaking to the CBC's Marina von Stackelberg yesterday, Health Minister Mark Holland defended it against criticisms from the Canadian Autism Treatment for Medicare Coalition.
Look, the framework and the strategy that we announced are a really important first step, and I was very careful not to hold it out as more than that. It gives us the compass and the map of where we need to go, and it means that provinces and the federal government and territories have to do everything that's contained in that strategy and in that framework to really materially change the lives of both the people living with autism and their families who have carried way too much, and I fully acknowledge that.
Health Minister Mark Holland responding to criticism of the federal government's new framework and strategy for autism. Andrew Kavchak is the parent of a 23-year-old autistic son who is nonverbal. Mr. Kavchak is a member of the Canadian Autism Treatment for Medicare Coalition, and we reached him in Ottawa.
Andrew, does that acknowledgement from Minister Holland, him describing this as a first step, and he later went on to say in that interview that he understands the frustrations of families like yours, does any of that reassure you?
No, it doesn't at all. When the minister says that in this framework and strategy and proposal for this national autism network, that it constitutes like a first step, well, the Prime Minister Trudeau said in 2019 that his government would develop and implement a national autism strategy. So we've been waiting for 5 years. And parents like me, my son was diagnosed in 2003, and when I realized that, the waiting lists for access to treatment were atrocious, I started protesting for federal involvement to assist the provinces. And I started protesting on Parliament Hill in 2004. I mean, that's 20 years. And after 20 years, he says this is, we're at the starting line, and that this strategy provides a vision and a compass of where to go. That's not true. If you look at the documents, there's no explanation of where we're going. I mean, there are just some high level general vision statements about, the objective is to make life better. But how are you going to do that?
What are some of the ways, Andrew, let me just ask so our listeners understand, what are some of the ways you feel this strategy, apart from the timing issue, which we know you're concerned about and so many others are, how does it fall short for your family, this strategy specifically?
Okay, I'll tell you, for parents of children who are severely affected, like I am, my son is 23 years old, there are 2 primary concerns. Number one, when a child is diagnosed, it's to get access to treatment immediately. Intensive behavior intervention treatment has been demonstrated since the 1980s as being the gold standard to try to help these children develop to their full potential. And there's a sense of urgency. So getting access to that treatment is the number one priority. And right now, we have a real problem. When my son was diagnosed in Ontario, there was about 1,000 kids on the waiting list. Today, there's over 70,000. And the second thing is, once a child becomes an adult, if they are still unable to live independently, like my son unfortunately is, it's a question of access to group homes. That's the second most important priority, that when he was 18, we had his name placed on a waiting list for access to a group home, and we were told that my wife and I would be taking care of our son until we could no longer do so because there was such a chronic shortage of group home places.
That was 5 years ago you put him on the waiting list.
On the first day that he was eligible on his 18th birthday. And we were told that in Eastern Ontario, there are people in their 80s, parents in their 80s, who still care for their disabled children at home. Now, this is crazy, because the thing is that taking care of a seriously disabled child that requires care 24/7 with every step, throughout the day, from, dressing, toileting, food preparation, eating, daily activities, and so on. I'm not getting any younger. And as parents age, I mean, we just don't have the energy. I don't know how I can be expected to continue with this. I don't know. The government just says that this is a first step, but first step towards what? The strategy doesn't provide a single reference to treatment, and it doesn't provide a single reference to group homes.
The Public Health Agency, as you likely know, earmarked $6.5 million to establish a national autism network that would implement this strategy, and then a framework to accompany it.
Not quite.
You don't think that's reassuring?
If you read the documents, what it is to create a national autism network, which is going to be, a bureaucracy with a board of directors that's going to create advisory committees, and they're going to work with the Public Health Agency to develop an implementation plan for the strategy and the framework. There is no implementation plan at this moment. So we've waited for 5 years for the government, but there's nothing to implement.
So what do you think would change things more tangibly? What needs to happen in your view?
20 years ago, a group of parents of autistic children took a case from British Columbia all the way to the Supreme Court of Canada, arguing for access to treatment through the healthcare system with Medicare coverage. And unfortunately, they won at the lower courts, but the Supreme Court of Canada rejected it and said all questions about healthcare are entirely up to the legislatures, and the Canadian Charter of Rights has nothing to do with it, including the equality provision. So, in 2007, the Standing Senate Committee on Social Affairs did an inquiry into the funding of autism treatment in the country, and they issued a report with the recommendations to the government that the government convene a meeting with the provinces, put some money on the table, and negotiate for improved access to autism treatment. And, unfortunately, the government, every government since then, has completely ignored that recommendation. And,
why do you think that is? Why do you think you're not getting what you need sooner?
That's a good question. Money has been earmarked and tagged specifically for certain medical procedures, and we've asked that the same thing be done for autism, and we consistently get a rejection with the statement that it's provincial. Well, if it's provincial, the federal government has to acknowledge that it in fact does have a huge role to play in healthcare. It does influence the healthcare system across the country. So I think the reason why the federal government has so far refused to do anything in that nature regarding autism is because there's simply no political will. Our children don't matter for some reason.
Andrew, I'm sorry you and your family are going through this. I very much appreciate your time. Thank you.
Thank you.
Andrew Kavchak is a member of the Canadian Autism Treatment for Medicare Coalition. He's in Ottawa. We contacted Health Canada about this story. A spokesperson sent us a statement that reads, in part, quote, "While provinces and territories are responsible for the delivery of services, the Government of Canada will continue to work with them to advance the needs of autistic people in Canada," unquote.